Okay, this is a case to follow up on what we said about preparations in rest preparation because of chrome cobalt. First, my comment is the plaque. Just a quick comment on the side. Plaque, make sure that the patient has full periodontal treatment, and if he has already done it, then his daily routine should not have this plaque around. Okay, so you have done rest preparation. My comments on this rest preparation: you see the incisory. First of all, the amount of width of the rest preparation is excellent. It's 1/3, but here it's sharp. I could feel the sharpness here, and there is sharpness here. I'm looking at an image, by the way. So if I'm sure that if I touch it with a probe, it will be sharp angle. The rest preparation should be an open saucer shape. It should not have any margins. So you need to round out this. This seems rounded out, but you need to round out more. Now this is the enough thickness you need for 1.5 or 2 millimeter. So for the thickness for the metal for rest preparation. But now you're into dentin, and this explains what we said about elderly patients. We do the correct thickness of the rest, okay, and we think that ourselves we're still in enamel because enamel is 2.5.
No.
Why is it in dentin now? Because this is an elderly patient that already had worn out some of the occlusal enamel. So now you're into dentin. What's your measure? Increase it a bit more wider, and then line it with composites. Okay, it should be lined with composite. You should not expose any dentine in here.
Okay.
Another option is complete it like a class 2, okay, because the lining of the composite is thin. It might fracture off. So you either line it with the very strong composite, posterior composite that is very strong, 1 millimeter thickness, or you need to go for a class 2 cavity and make enough thickness of composite beneath the rest preparation because you're in dentine now. Okay, your canine preparation, the cingulum rest is okay in terms of thickness, but once more you're indenting, and this needs to stay sharp because we need an acute angle in the this sulcus, but here you need to make it obtuse. It should be open. It should be flush, the upper part. The lower should be like a ledge عشان تعمل a step. To make it as a step, as a shoulder, as something that will retain. And when it's an inverted U shape, it's even better in terms of stability as well. But the upper part should not have the step. It should be flush with the enamel. Now, once you finish this, if this is dentine, I'm not sure from the contrast of the color, but what I see that now you are in dentine here. If you are in dentine here, you need once more to cover it and line it with composite, or think about a veneer and so on. Okay, so these about preparation.